Good afternoon. My name is Carl Cooper. I'm the Director of Public Health Programs at the American Association on Health and Disability, and we want to welcome you to another one of our presentations on our ADA celebration. On Tuesday, the Americans with Disabilities Act turned 32, and to celebrate this fact, we at AHD are highlighting what the ADA means to us. Throughout the month, we've been conducting interviews with some of our board members to emphasize the importance of this landmark legislation. We've already spoken with Mike Honig and Lisa Iazzoni, who shared how the ADA has helped them and the work we still need to do. And today we want to welcome Dr. Amy Hautrout to our discussion. So, Dr. Hautrout, welcome to the conversation today.
Well, thank you for having me. It's a great honor.
And if you could just start out by telling us who you are and where you're at, that would be great.
Well, as you said, I'm a doctor. I am a pediatric rehabilitation medicine physician, which means that I take care of children with disabilities in my clinical practice. The goal of the work that I do in medicine is to optimize the health, function, and well-being of children with disabilities. And as a doctor, that means in clinic, I see children with a wide array of disabilities, whether they're temporary or permanent, arising from birth or being acquired somewhere during their childhood years. I am also a health services researcher studying access to care and health equity for children with disabilities, and I am a person with disabilities myself. I have a very rare genetic condition. And I'd like to just start out to give people an image of who I am. I'm a pale white woman with short brown hair, and I'm sitting in a chair wearing a white and black jacket and a rainbow shirt, and I have purple glasses on. There are pictures on the wall behind me.
Thank you very much for that description. And where exactly are you located?
Oh, I should have said I am in Pittsburgh, Pennsylvania. I'm very lucky to work at UPMC Children's Hospital, Pittsburgh.
That's great. And in terms of your role with AHD, you're relatively new to our board, correct?
I am. I'm a total newbie to the board, but I'm definitely honored to be a part of the group. I always enjoy learning from the other board members and being so impressed about the work that we're doing on behalf of people with disabilities to promote their access to healthcare and making sure that people with disabilities get what they need to thrive in their communities.
Okay. You already started to do this a little bit. To the degree you're comfortable, can you tell us a little bit more about your disability you have yourself?
Oh, sure. So I was born with an exceptionally rare, one in 200,000 children are born with this condition. It's a skeletal dysplasia. It's called Conradi-Hunerman syndrome. And don't worry, there won't be a quiz on that later because no one would know what it is. But skeletal dysplasia is the one that most people might think of when they think of that kind of condition as achondroplasia or dwarfism. And so it's in the class of skeletal dysplasias, but not somewhat similar, but not really similar to dwarfism. So I have a lot of bony problems. I also have cataracts and hearing loss, and had a lot of hospitalizations and surgeries when I was a wee one, a little kid. And I'm not that big now, so I guess some people might call me wee today.
Okay. In terms of the Americans with Disabilities Act, then, what does it mean to you specifically both in the work you do as a professional and also personally?
That's a great question. When I was reflecting on this, I immediately just started to think about it from the perspective of the group of people with disabilities of whom I'm among, and then all of the people who have disabilities that I'm involved in the care of clinically, or that I'm focusing my research on, or I'm teaching others about how to promote health and function. So I started to think about it. Okay, well, it's obviously a civil rights law, and it's about prohibiting discrimination against people with disabilities. And we have civil rights laws for all sorts of things. So based on race or gender, sex, national origin, age, religion. And as such, we think about prohibiting discrimination. And what that means is that we're assuring that people with disabilities have the same rights and opportunities as everyone else. But we also know that that's actually not what's happening. So for me, the ADA is more like a promise or an envisioned future, and where we have eliminated all of those discriminatory barriers so that people with disabilities like myself, like the kids I care for in clinic, like one out of every, 4 older Americans has the ability to participate in life as they desire, to be integrated in their communities, make choices on their own behalf, and be engaged in their communities as they want to be. And so I think about it more like there's something that there's a promise. And we often think about the ADA as about like, oh, a curb cut or being able to get into a building. And while that's certainly pieces, yes, that's what the ADA is about. We want to have physical access. There's also attitudinal things that the ADA, for me, it's about a promise that we eliminate that attitudinal discrimination, that we eliminate ableism. And I think that's a lofty but incredibly important goal that we have as a society. We need to, as a society, eliminate all different forms of oppression. So whether that's based on the color of your skin, racism, whether it's based on whether you're poor, classism, and then ableism, obviously for people with disabilities, and really value our diversity as a human population, and also respect that diversity and understand that no one is less than because they might have a disability or their skin color might be different. And so for me, the promise of the ADA is so much about what we as a envisioned society could be.
Yeah, that's fantastic. And in terms of what you see, you say you work with children with disabilities. What, how do you see it affecting your practice and how you're able to provide services to them? Has it changed over time in terms of what you're able to do and maybe provide better service to them?
Well, so I hope that that's true, but I can't necessarily tie this directly back to the ADA because I grew up and trained in a post ADA world. But I would say that we've been doing some evaluations of things about actually accessing clinical spaces, and we know that that's still a problem for people with disabilities, children with disabilities, and their families. And that includes physical access or braille access if you have low vision, or sign language interpretation if you need that. And so there are still, even in the healthcare system where we are dedicated in our clinical care as rehabilitation doctors to provide care for people with disabilities, we know that there continue to be struggles, that access is a problem, physical access and other types of access. And then actually, there are just not enough pediatric rehab doctors out there in the country. So that is something that has gotten better over time. I mean, I have a very rare genetic condition, and I also happen to be in a very rare or unique field of medicine. There's only 350 pediatric rehabilitation medicine doctors in the entire country.
Mm,
There are states that have no pediatric
wow.
rehab doctors. So what that means is there's a lot of kids out there who aren't getting the rehabilitation care from a specialist like myself that might benefit from it. So when I think about that kind of access, I know it's really uneven. Children who have disabilities who are in rural areas are just much less likely to get the services that they might have available to them if they were in a big city like Pittsburgh with a quaternary care children's hospital and several pediatric rehab doctors.
Mhm. And in terms of you mentioned you've done research. In terms of the research you've done, is there anything especially that you're proud of in terms of things that have come about, maybe with policy change that you'd like to you point to in terms of how things have improved?
Sure. I love that question. And when you said what you're proud of, I want to stop and take a second because what I'm really proud of is all of the collaborations with
Mm,
people from different
absolutely.
disciplines that I've gotten to have over the course of my career. The people who have I've been so honored to be mentored by so many phenomenal researchers. And now I am lucky enough to be in the position to also mentor. And so that part of research is actually what I'm most proud of, is the kind of the relationships and the building of research to demonstrate what we need to do to change things. But more specifically to your question about, well, how does this impact policy? I think this is one of those situations, and other researchers, if you're listening, are probably they're thinking and nodding their heads, yeah, like, okay, I did this research, but then what happens,
Hmm.
right? And you want your research to be meaningful. And so I'm going to just give you a couple of examples where it has been really meaningful. So home and community-based services, which a lot of people with disabilities rely upon so that they can successfully live independently in their communities. Um, there are states that allow family members to be paid providers. So to provide that service and earn a salary doing so. But there's been a lot of concern that they couldn't possibly be as good at providing that care as someone who's paid from an agency of home health providers. So we were very lucky when I was at UCSF several years ago to have access to data where we could actually compare if a family member was the paid provider versus an agency provider to see if there were differences in health outcomes. Were those individuals who had disabilities receiving that care from a family member more likely to end up in the hospital or end up in the emergency room? Well, the answer is no. They weren't more likely to be sick. They were getting good care from their paid family member. And then what that means is the state says, oh, look, we have this information. We can continue to do this. Instead of a demonstration project, now we can just roll this out and have this be typical and available. And then other states can use that same data and say, yes, this is the best way for us to help address a major workforce shortage. And so that we were just very lucky to have access to that data, be able to demonstrate it, and then give it to the people who needed it to help make policy decisions. And then the other thing that I think is really interesting about how we influence policy is sometimes it's like a policy that doesn't happen, right? And so the other example I'm going to give you is an example of a policy that didn't happen. So several years ago, there was proposed legislation in the House that was going to tie SSI benefits, so Social Security benefits for kids with disabilities, to their attendance in school. And first of all, that would have been administratively very hard to execute, right? How is the Social Security Administration also going to become truancy officers? Like
Hmm.
that's just, I mean, it's not really feasible to think that that could be possible. But what the bill was intending to do was make sure that if you were going to get this financial benefit from SSI, that you would also be going to school. We happened, not related to this bill at all, be doing a study where we were looking at kids who were on Medicaid and had disabilities and had SSI, and then kids who didn't have SSI. And there was no difference in their attendance in school. They
Hmm.
attended school at the same rates. And we were just very lucky to have that data from a national survey. And we shared that with the House Ways and Means Committee. And then they took that back and said, you know what? We don't need a piece of legislation that says that we have to tie school attendance for people to get their SSI benefit. And so that piece of legislation went nowhere. And
That's great.
thankfully, because it wasn't going to be
Yeah,
something that could be implemented. So we saved a major, major administrative burden from happening. And we um, got them to understand it really wasn't about missing school.
that's great. While you were giving that last one, we did get a question in
Yeah.
Facebook from someone that was asking about the first thing you were talking about, which was the HCBS study. Noelle wants to know, are those HCBS study results published somewhere?
Yes. So this one study that we did on cerebral palsy is published, and I can make sure that that gets put into the transcript and the link for it. And I mean, one of the funny things about that study is it was a study where they found no difference. And in most research studies, you want to show a difference, but we wanted to show no difference, and that's what we showed.
That's great. All right. Well, you talked a lot about what the ADA has meant to you in terms of your professional work. What about yourself? You said you mentioned that you were sort of more post ADA. I know we had this conversation with Dr. Izzoni last week, where she was talking about how she was more pre ADA when she was going through her med school and stuff. So, in terms of personally, how have you seen the ADA has helped you?
Well, certainly as someone who knows what it's like to be judged based on the way you look and your disabilities, I appreciate that the ADA is setting forward this goal of kind of eliminating discrimination. And for me, when I was in training, there had to be a lot of adaptations for me to do the things I am not a tall person. So we had to have all these risers so I could peer in to help in the operating room, right? So there was a lot of that kind of accommodation. And I think what was really great about my medical school experience and throughout my training and my career is that everyone just knew that that was the right thing to do. That it needed to be that it was possible for me to participate, to learn, and contribute to the medicine that we were doing, and so that I wasn't being excluded from those opportunities. And I think that kind of way that the ADA, it's for everything in public life, right? And so it was very good for me because it meant that there was just this base understanding that here she is. She's in medical school, or she's now a doctor in her residency, or now an attending, taking care of patients in clinic. And if we have to do adaptations to make me as successful as possible in my job, we do those adaptations.
That's great. Let's talk a little bit about your the work you're doing now. In terms of things that you've published recently, is there anything specifically you'd like to share or highlight?
Well, Carl, thank you for bringing that up because, of course, there is something that I want to highlight. So, one of the things that I am most proud of the work that I get to do is related to working with national experts from around the country to promote health equity for children with disabilities. And recently, the Maternal and Child Health Bureau has put forward a blueprint for change for children and youth with special health care needs. So, children and youth with special health care needs, that's about 20% of all children, have chronic health conditions that impact their lives. They need more medical care, or they need specialized services, or they have disabilities. And the blueprint for change really is a vision for the future in which all children with special health care needs, including those with disabilities, are thriving in their families and communities. They're living full and complete lives. And there are 4 pillars of how we get there in this blueprint for change. It's about child and family well being as one of them. And I got to lead the section on health equity. Then there's also access to services, as well as how we think about financing these services. And the blueprint for change just isn't about what the Maternal and Child Health Bureau does. And obviously, they play a big role through Title V and services at the state level. But how we as an entire society and folks in various different organizations and spaces are working towards that same goal of helping children and families thrive in their communities. And so for me, I really want to highlight that we were very lucky to be on, and our team was honored to write the section on promoting health equity. So the fair and just opportunity, regardless of your circumstances, to be as healthy as possible. And what that means is that we're eliminating things that oppress children with disabilities in society, like poverty and discrimination. And then in every space where we're delivering services, whether it's healthcare services or educational services, that we're also working to eliminate disparities or differences. We're working to eliminate discrimination in those spaces.
Okay. And where can people find that blueprint?
So that blueprint for change was just published in the Journal of the American Academy of Pediatrics, the Pediatrics Journal. And I think we can get a link to that as well. And you can download all of them for free. There's several articles. There's also a very nice article that kind of gives you the history of Title V and the Maternal and Child Health Bureau work for children with special health care needs, and a great overview of children with special health care needs and what's going on for them now using national survey data.
Okay. And did I hear that maybe there was a podcast that was done about all this?
Yes. Oh, it was super fun. I got to do a podcast, and I had to be the follow-up to Michael Warren, who is just so phenomenal on the podcast. And it's the Pediatrics on Call. It's a great opportunity if you want to just get a quick listen to what had happened about the Blueprint for Change. And I certainly encourage you to read it, but it's also a great listen. And I think we're going to put that for everyone to see and link to.
Okay. And it looks like we've added that link in the chat so people can access those documents if they want those. So that's a fantastic resource that hopefully will do a lot to continue to improve the care of children with disabilities. So thank you very much for being involved in that. And thank you very much for joining us today. I've enjoyed our conversation thoroughly and learning about what you do and what you're doing to really continue to improve things for people with disabilities and children with disabilities, and celebrating the ADA and what it means to our community. So thank you very much for joining us today, Dr. Hautrout.
Well, thank you for having me, and I'm so excited to celebrate the ADA with you.
Okay. Well, thank you very much for joining us today. And this is going to be the end of these interviews we're doing. But like I said, we have all 3 of these interviews that will be on our Facebook and YouTube pages. So please, if you haven't had the opportunity to look at the other ones, please do so. Thank you very much for joining us today.